in ensuring that this, what they are doing actually is implemented against the wind that is blowing in our country. Thank you. So I'm going to summarize some of the key insights from this colloquium and highlight some of the essential points that are critical. Of course, the meeting was officially opened, introducing key leaders and policymakers, which is good, which means that all this discussion is going to the right place. And the goal that we're told was to unite the stakeholders in the health sector to discuss the national health insurance and address the anxiety surrounding some of the work that is being done. I'm not sure if we've achieved that, because when I listen to Sama, I'm not sure if they're buying in. But most of the people that are here are buying in. So that's good. It's making progress. Thank you. If you have shifted, please withdraw the case in the court. They emphasize that, this room emphasized that policies must engage society inclusively, ensuring continuity of healthcare access across generations. So it doesn't end with us, it continues beyond us. On the question of challenges and inequality in our South African healthcare, we have to deal with the question of persistent inequality in healthcare access due to problems of socioeconomic status. Of course, race is another issue. Medical schemes only serves a fraction of the South African population, leaving the majority reliant on the public healthcare system. And that is what NHI is dealing with. We heard that there is still continuing a quadruple burden of disease of HIV, TB, cardiovascular diseases, and maternal and child health. I would also say COVID. We need to add COVID because it's still there. We just don't pay attention to it. We have it. There are new strains that keep coming. We still need to wake up to it. And the high cost of healthcare limits accessibility. That is what I heard. The other thing that I heard, which is really of concern, and it was also said in the video by the president, that misallocation of healthcare funding favors the private sector, which in a sense worsens disparities that we're experiencing. On the question of framework and implementation of NHI, we heard that the NHI Act serves as a foundation requiring system enhancements and partnership for successful implementation. We heard that we cannot do much without working together. And I'm asking Sama to join us and work with us for our people. We all need to do that. The country must recalibrate funding flows, conduct cost analysis, and prioritize access to essential services. We heard about comparison with the Thailand system, which successfully addressed economic and healthcare challenges. So that is something that we have to do as we implement NHI. We're also told that we need to address the key areas for effective NHI implementation, that the NHI financial structure must work out in such a way that we end the imbalance between the public and the private sector funding. If we end that, we'll be able to ensure universal access to healthcare coverage. On technological integration, we heard that we have to focus on the AI and digital systems to improve efficiency. We should no longer be going to the next person sitting next to us and say, what does that mean? We must go to AI. AI should be our friend, should always be in our pocket, very, very close to us. Pick up a cell phone, you look at it, you say, what do they mean by this? You get all the information that we want. We need that, especially as we start implementing NHI, because it could speed up the implementation. And on the debate over the mandatory versus voluntary prepayment models, so that people understand exactly what that means. Many people will tell you, I still need my medical aid even if there is national health insurance, because they don't understand what national health insurance is going to do for them. And then, of course, there is a big problem of concerns about funding shortages because of the global health initiatives that are really suffering. Some of them, as you heard, are going to be bringing those offices here in South Africa, and many other places. Let's use that opportunity to learn from them, to get international experience into our own system in the country. On the NHI benefits and actionable steps, financial protection is said to be very critical so that we don't bankrupt people because of the fact that they cannot pay for health services. There is a need to test the new payment models to enhance efficiency, and also we should define services covered under NHI to ensure transparency. That work that you say the department is doing with regard to the benefit package needs to be accelerated and shared widely, because it will remove this fear of, will I still be able to get healthcare in the country? Because some of the concerns people have are real simply because they don't have information. Once they have information, they may change their mind. And of course, ensure community involvement as a key principle to ensure success. On health system strengthening, the issue of our traditional healthcare practitioners, we heard what the minister said. I will not repeat on that. On the themes and core objectives, the NHI, remembering that it's a human right, ensuring this universal access to healthcare, where healthcare does not solely benefit the rich, is key. And that standardization and inclusivity is key. The NHI aims to guarantee equal access to healthcare for all citizens, including foreigners as well as children. And with foreigners, they have to come in with their own insurance, and they can be able to get emergency services if the need arises. And address the co-payment issues, because it's very clear, because healthcare is very, very expensive. On the NHI development and implementation challenges, we should look at the historical context, understand that we started in 2007 that there should be NHI. People are waiting for it. So let's gallop and make sure that it actually happens. It's very critical for us. And then on conditional grants that are going to be given to provinces with money that's unused, which ends up going to Treasury, raises concern. And that is something that we have to deal with if we're going to implement NHI effectively. And of course, the new system under NHI will require centralization and the money going in straight to the districts and to the facilities to make sure that funds are actually spent by those facilities. And then on the proposed solutions and role of technology, we talked about digitization of healthcare, that the Health Professions Council must act in line with the National Health Policy and make sure that they support NHI through digital record keeping and harmonized regulatory tools. On community-based care, we should involve community health workers in equity-driven models to ensure populations receive comprehensive care. The private practitioners and NHI, will private practitioners continue under NHI? Of course, they will. The Health Professions Council of South Africa must align with government policy, that's what we had. They must regulate the healthcare providers accordingly. And of course, they should be using the capitation model. And it was a good discussion about capitation itself, how it can actually be implemented. What is it and how it can be implemented. But we must address some of the challenges that doctors are having, the trust that government has with regard to payments. Contracts must ensure reliable reimbursement. So consultation should happen with the doctors so that they can understand how they are going to be paid. Because the bottom line is that they want to know, will I be able to get my pay when I want it? Because currently there are some problems in some provinces where money is not paid quickly according to the contract. And then of course they are concerned about workloads. Progressive doctors are emphasizing maybe you should go for health promotion in order to reduce the demand, rather than just to wait for acute care patients that need to be taken care of. And then change, of course, the healthcare approach. Treat populations rather than just individuals, so you can cost effectively and provide quality healthcare. 2 more points. Medical schemes and regulatory role in the NHI. Under the NHI, medical schemes will see reduced revenue. Of course, it will lead to consolidation and complementary coverage rather than full healthcare provision. And then there will be a need for regulatory oversight, and the Council of Medical Scheme will support the NHI policy, ensuring equity is maintained and transitioning away from healthcare as a commodity. Then on final considerations, South Africa must ensure fair allocation of funds to improve public health care. The NHI should adopt a single payer system for efficiency. The trade unions and medical professionals should collaborate with government to refine policy execution, not to refine the act. The act is passed, but in terms of execution, they need to come on board. And doctors advocate for self-governance, avoiding excessive administrative control. We should address their concerns with regard to that. And there should be agency in misallocated of resources. In conclusion, we heard about the equity in access, that NHI is going to prioritize affordability and fairness for all South Africans. On efficient resource management, the government must ensure financial and healthcare resources are deployed effectively. And of course, there should be an integrated approach where NHI combines primary healthcare technology and community-driven models for success. And working with the private sector is also key for success of NHI. And the law does say exactly that it's going to happen. Thank you very much.